Hi, my name is Daisy Gomez, and I am an occupational therapy student from the University of Texas Medical Branch. Welcome to my presentation on sensory processing. If you have not already, please go ahead and fill out that pre-survey. It's in the description of this video. And with that said, let's continue. So what do you know about sensory processing in children with autism spectrum disorder? You can go ahead and pause this video to think about your answer. Okay, what is sensory processing? How one's nervous system accurately interprets sensory information in the environment. Those whose nervous system does not accurately interpret sensory information are said to have a sensory processing disorder. It is estimated that more than 80% of children with ASD have sensory processing differences. Okay, let's discuss the 7 senses. We have sight, smell, touch, taste, and sound. And these are the common senses that we all think of. But then we have vestibular and proprioception, which are typically referred to as our hidden senses. And vestibular tells us about balance, and proprioception tells us about body awareness. So joint and muscle sense, kind of where we are in space. Okay, so sensory processing differences can range from mild to severe. So on the mild side, you can see behavioral quirks and minor difficulty in everyday life. Then on the severe side, you can see serious behavioral / performance dysfunction. So sensory processing differences can be split into 2 categories. You have sensory-based motor problems, and then you have sensory modulation problems, which we will discuss further in more slides ahead. Okay, sensory-based motor problems. So here are some characteristics. A decreased ability to plan and carry out movement. So without that ability, the child can have poor coordination. And then there's poor balance and posture. And this may be due to difficulty with discriminating vestibular, proprioception, and tactile input. So earlier we said vestibular, that sense allows us to understand our balance. Proprioception is body awareness, and tactile input is simply touch. So this can affect how one moves in and interprets how one moves in and interacts with their environment. So here in this picture, you see maybe a child who has poor coordination, is a little clumsy, and is constantly falling and is having trouble learning how to ride a bike. Okay, and now we have our sensory modulation problems. So what is sensory modulation? It is how an individual reacts or responds to sensory stimuli. And there are 3 common types of sensory reactivity profiles, which we will look at next. Okay, so we have our sensory over responders, we have our sensory seekers, and our sensory under responders. Okay, so our sensory over responders can have an overreaction to sensations. They will attempt to move away or block sensory input. They may react aggressively or controlling when overwhelmed by sensory input. They can be cautious, fearful, and upset by change in routine, and they can shut down. For our sensory seekers, they seek constant stimulation, like crashing, bumping, jumping, and roughhousing. They are constantly touching objects. They like to lick, mouth, and/or chew on objects, and they take risks during play or physical activity. And then for our sensory under-responders, they do not respond to sensory input as one should. They are unaware of body sensations. They have passive behaviors. They do not notice others in the room. They may be slow to respond, withdrawn, or have no interest in exploring. And they have a lack of awareness of danger. So,
How do occupational therapists help? One way is with sensory integration therapy. You might see it abbreviated as SIT. So sensory integration therapy entails providing the child with a range of sensory opportunities with special equipment and gyms based on the child's needs. It is goal-directed, play-based, and sensory enhanced. It can help improve the ability to process sensation, therefore improving movement and or specific behaviors. So the behaviors that we talked about earlier, like the hypo-responsive or hyper-responsive kids. So this is an example of a video of sensory integration therapy in action. Unfortunately, I can't play it while talking in this presentation, so I will link it in the description so you can watch it yourself. So here is an example of a gym that would be great for sensory integration therapy. There is a swing to stimulate the vestibular system. There is a pressure swing to stimulate the proprioceptive system. There are varying heights. There's things for kids to climb. There's a crash ball pit. Here's another one. And here is another example too. So ideally, this is what you would want a sensory integration therapy gym to look like. In addition to doing sensory integration therapy in an occupational therapy clinic, your occupational therapist might prescribe a sensory diet to you that your child can do at home. So they are sensory-based activities and or strategies utilized during the day to help the child regulate themselves outside of the clinic. They are personalized to the child and they can consist of various sensory inputs and child-preferred sensory inputs. Let's discuss sensory inputs a little bit. So they can help a child feel calm or alert depending on how the input is provided or used. So general motion activities alert and organize the mind and body. Pressure calms and settles the body. Heavy work can be alerting and calming. So heavy work would be like pushing a heavy laundry basket, picking up heavy books, and so on. So if you have a child that really likes vestibular-based activities that helps them maybe calm down or alert them more, activities that would fall under that are like swings, jumping on trampolines. Proprioceptive activities can be animal walks, jumping jacks, and cross crawls. Visual activities would be like mazes, lava lamps, matching games. Tactile activities would be like sensory bins, vibration, playing with fidget toys, slime, Play-Doh, and gustatory, olfactory, and oral motor activities would be like if they really like smells, maybe essential oils will help calm them down, or eating sour or spicy candy can help alert them. So really your occupational therapist can help you identify what sensory experiences that your child likes or seeks, and then based on that they can design a sensory diet for them. So the overarching goals are to improve the ability to process sensation, to improve movement and or specific behaviors. So recall those 3 common sensory profiles. So we have the kids that are constantly seeking sensation, who are under-responsive, and then you have the other kids that are over-responsive to sensory stimuli. So they help the child with their arousal states, so it can help them calm down or allow them to feel more alert depending on how the activities are used. And once the child is regulated with their sensory needs, then it can allow them to participate effectively in daily activities. I'll leave you with this question. Do you know anyone who has sensory differences who might benefit from occupational therapy?
Okay, thank you so much for watching this video. Please go ahead and fill out the post survey. And if you are interested in the resource that I have for this particular video, please go ahead and click on it in the description. I have it linked in the description box. And if you're interested in learning the purpose of the resource and how to use it, I have also created a video going through the resource. Okay, thank you so much.